I'm Maria Boynton reporting. Today, my guest is Dr. Germaine Cummings. She is in family medicine here in Metro Atlanta. Her subspecialty is geriatrics, and today we're talking about influenza. We all know it as the flu. Are you surprised at just how bad it is right now?
I am surprised at how sick patients are presenting to my office this year.
Oh, really? It's that bad?
It's bad. They're coming in with some atypical signs. Most people don't have a fever, but they have the severe chills and muscle aches and just generalized body pain.
Dr. Germaine Cummings, what are you telling people right now when it comes to having the flu or preventing the flu?
I'm telling patients that they need to wash their hands. They need to make sure that when they're around people who are sick, that they wear a mask. But most importantly, I'm telling people to go ahead and get that flu shot.
Now, let's talk about influenza in itself. What is influenza?
The flu is a virus that's spread among people by droplets, usually respiratory droplets that get inside the mucous membranes.
And when you say droplets that get inside the mucous membrane, so that means it comes from somewhere else?
It comes from either people talking, coughing, sneezing. And of course, we don't know when those droplets get on door handles or they get on utensils or anywhere in public places, and we spread it into our own body. Then the virus can replicate.
Now, what are the symptoms?
The symptoms are mostly a fever greater than 102, sneezing, sore throat, body aches, chills. It's a cold, but it's a cold on steroids.
Oh, wow, a cold on steroids. Now, when we talk about the flu, who's at higher risk?
The people who are at higher risk are children under the age of 5. Of course, our elderly population, those greater than 65, or people who have disease processes like COPD, which is a lung disease, diabetes, anybody whose immune system is compromised. They're at greater risk of having severe symptoms from the flu.
Now, you said that geriatrics is your subspecialty, so are you seeing a lot of elderly coming in with the flu?
I'm seeing, my elderly population, they're very good about getting their flu shots, but those who don't, they have a severe case and usually end up in the hospital.
Or worse, I guess. Okay, we're talking to Dr. Germaine Cummings. She is in family medicine. Now, your office is in Metro Atlanta. Where exactly?
My office is located at 367 Athens Highway, Suite 2300, Loganville, Georgia, 30052.
Okay, Dr. Cummings, thank you very much. So, how can I avoid getting the flu?
The best thing you can do by avoiding getting the flu, of course, is getting your flu shot, but just doing some lifestyle changes, making sure you drink plenty of water, stay hydrated, making sure you also get plenty of sleep. And also, I tell people to eat a healthy fruits and vegetables a lot during this time of the year, which is high in vitamin C and zinc.
Okay, and I know you wash your hands.
Hand washing is predominant.
And that helps, what, stop spread of germs?
That helps to stop the spread of germs.
And what about exercising?
Exercise is good, but we want you to exercise on a well-rested, hydrated body.
So get a lot of sleep.
A lot of sleep.
Okay. So now, and if you are sick and you're presenting all these different symptoms and you just have to go out, how do you try to prevent others from getting it from you?
Of course, keep hand sanitizer on you. If you can, wear a mask. Try to avoid populations that are dense, such as like church or any area where they're going to be vulnerable population like children or older people. Mostly if you're sick, the best thing to do is stay at home until you get over it.
Now, we know that some people who get the flu vaccine still get the flu, right?
Yes.
Is it a milder case?
It's usually a milder case.
Okay, so should I get the flu vaccine?
Definitely get the flu vaccine.
Well, they're saying that maybe it's not so potent right now.
Well, that is true. It might not be as effective, but what we're trying to do is lessen the severity of the disease process. Okay. So even though you may still get the flu, the goal is that you lessen the amount of days that you're sick, and you also lessen the symptoms, the severity of symptoms.
Now, we're talking about who should get the flu vaccine, or should we get the flu vaccine. Is there anyone who should not get the flu vaccine?
Really, there's no one who should not get the flu vaccine unless you've had it in the past and you've had a severe allergic reaction. But otherwise, there's really no contraindication for the flu vaccine.
Yeah, and I know children, under 6 months?
Under 6 months, you don't want to get it, but if you're greater than 6 months and you've had it before with no severe reactions, you can also know the old myth of egg allergies, that doesn't really apply. So there's no one really who should not get the flu vaccine.
What about those who have had Guillain-Barré?
Well, Guillain-Barré is a complication that can come from having the flu vaccine, but it should not cause it. So if you've had it, you may want to talk to your doctor a little bit more in detail about whether or not you should get it and see whether or not the benefits outweigh the risk.
And what about the nasal vaccine? Is that effective?
That is just as effective if you have a needle phobia. We usually use that for people who have a fear of needles.
Mm-hmm. Okay. So let's say I get the flu vaccine. We did say that I can still get the flu.
Yes.
Now, so I'm not 100% protected then.
Well, you are to a certain extent. You know, with these viruses replicate and they change year by year. But with the different strains of the flu that's in the vaccine, hopefully you will be protected somewhat.
Let's talk about the vaccine. Is it safe?
It is safe. The vaccine is safe, and it has at least you can have a 3-strain viral load, or you can have a 4-strain viral load.
No side effects?
No side effects. The only side effects, of course, if you have a prior allergy to flu vaccines, or you can have a complication of Guillain-Barré.
Okay. So I know some people get low-grade fevers, so don't they?
You can have low-grade fevers, but that's not because of you're being attenuated with the actual live flu. Mm-hmm. That's just a consequence.
And if you get the nasal spray, I guess your nose is going to run a little bit.
Yeah, but otherwise, it's fine.
Okay. So can I get the flu vaccine? Let's say if someone is pregnant or they're nursing, should they get the flu vaccine?
They are safe enough to get the flu vaccine. In fact, that's a vulnerable population of pregnant women. We like for them to get the flu vaccine.
So it won't cause my nursing baby to get sick?
No.
Okay, good. We're talking to Dr. Germaine Cummings. If you're just joining us, we're talking about influenza, better known as the flu. She is in family medicine here in Metro Atlanta in Loganville.